Good afternoon and welcome to our media briefing. I hope everybody had a very enjoyable weekend. We have a lot to catch up on, and I'm sure that there's going to be a lot of questions. So we're going to go straight to the update, and let me call up Supervisor Fletcher.
Thank you, and good afternoon. As we begin August, we look back on July and recognize it was a bit of a roller coaster. We saw significant increases in numbers, in outbreaks, in cases. We saw a significant surge, which required the tightening. But then towards the end of the month, we really began to stabilize and flatten. In the beginning of August, the numbers have been very encouraging. Our number of cases continue to come down. Our percentage of positive continues to come down. Our hospital system capacity remains very stable and healthy. And so this is an encouraging sign that tells us that not only the actions we took, but just broader awareness of the continued dangers of COVID have put us in a better situation. As a community, we are adapting to the increase in cases and what we saw. As you go out, you tend to see more people wearing face coverings. I think the general public is more aware of the need as we go through our reopening process of maintaining physical distancing, and in particular avoiding those large indoor type settings. We have a ways to go in terms of continuing to get our numbers down below the state metric that they've outlined for where they should be, and we know that we have to get there. But then we also have to figure out as a people how, when we get them down, we keep them low. And we keep them low in a way that allows as much as possible of our economy to be up and running. We keep them down in a way that allows us to really substantively start talking about how we can reopen schools safely, and we keep them down to ensure that we can go through this until we get a vaccine or a therapeutic treatment or some both, with as much of our society up and running as possible. And so we should feel good about the progress that we've made in the last few weeks. We should use that to motivate us to really continue to advance forward, to continue utilizing face coverings, hand washing, physical distancing, avoiding large indoor settings, and motivate it to, again, put San Diego as a region in a very positive position as we navigate through. So we're seeing really good progress, and that is really encouraging, and we know it's been through the hard work of each and every San Diegan making a choice to do this, and for that we are grateful. With that, let's jump into today's numbers. Today for our testing, we're reporting a 7-day average of tests at 7,454. This is well above our goal of 6,740. And again, we continue to do everything we can with the county testing that we control to turn those around very rapidly so we can begin the case investigation and contact tracing process. Our 14-day average of new cases, again, is 5.3. This is below our goal of under 8 and is definitely coming down from where we were in July, and so that is also encouraging. And then you see the cumulative number of tests. Under case investigations, it wasn't long ago we were standing here when this was in the single digits. We have worked very hard to try and increase our staffing and get moving, and so you can see there our 7-day average of investigations initiated within 24 hours is at 48%. To put in context of the progress we're making, if you just looked at the last 3 days, we would be over 70%. And so again, we had a problem, we took corrective action, we're doing everything to get this in line, and this continues to improve. 7-day average of close contacts within 24 hours. Again, the metric we track by is over 70%, which we meet. We're sitting at 86, and so we'll tighten that up a little bit. And then on the right side, you can see the individuals in public health rooms, the total number, along with convalescent plasma. Moving to the next slide, today we're reporting 343 new positive cases, and again, you can see the significant drop from where we were day to day in July. Again, day-to-day numbers don't mean a lot. It is trends over time and percentage of positive, which you'll see there at 5%. Again, not where we were early, but certainly much better than where we have been. And in the purple line there, you see the rolling 14-day average of positivity, which has flattened and is beginning to trend down, and that is encouraging. Likewise, in our hospitals, today we're reporting 124 ICU-related COVID patients, 390 total. And again, there you can see the general downward trajectory and trend, which is good. Total hospitalizations, you take the 390 of COVID, which you will see here on the next chart at the bottom. You add the non-COVID hospitalizations, and again, we're there at 4,277, holding relatively stable and flat. And then final chart is our ICU utilization. ICUs, we have 124 COVID-related, 328 non-COVID for a total of 452, which puts us at 64% of our ICU beds occupied. That concludes my report. I'll now turn it over to Dr. Wooten for a public health officer's update.
Thank you, Supervisor Fletcher, and welcome everyone to our Monday briefing. Today's global, national, and state statistics are based on data from the Johns Hopkins dashboard and were obtained today at noon. Nationwide, I'd like to note that the United States has reached another milestone of over 150,000 deaths due to COVID-19. Today's local statistics in San Diego County are from reports as of 11:59 yesterday. Today, there is a total of 30,226 cases, which is 343 more cases than yesterday. And this is a decrease in new cases since yesterday's report. This actually is an increase since yesterday's report of 306 cases. The overall total number of cases includes 565 deaths. No new deaths were reported yesterday. In the next slide, our age, these are our demographics for cases. Our age range remains the same from 3 months to 102 years of age. For the age group 20 to 49 years of age, this also remains at 59%, represented by 17,797 cases. 15,488 or 51% of all of our cases are female, and 49% or 14,614 are male. We have 2,599 cases that have been hospitalized, and this is holding at about 9% of the total number of cases. Of the number of those hospitalized, 656 have been admitted to the ICU. This represents 2% of the total number of cases and 25% of the total number of those hospitalized. In our third slide, this slide provides demographics related to hospitalizations. Of the 2,599 hospitalizations, the 50 and over age group represents the majority, or 71% of these cases, or 1,847 cases. Males represent the majority at 1,409 or 54%, and Hispanics or Latinos represent the majority at 1,480 or 61%. And 61% is the same percentage in the total number of cases represented by Hispanics or Latinos. In the next slide, the 565 total deaths represent 2% of the total number of cases. Of the deaths, 246 or 44% are female, 319 or 56% are male. 539 or 95% of the total number of deaths had underlying medical conditions, and 25 or 4% had no underlying medical conditions. And as always, the County of San Diego extends its sympathies and condolences to the family and friends of those who have lost their lives to COVID-19. Next, I would like to bring attention to the summary of all outbreaks. Since the beginning of the pandemic, 293 total outbreaks have been reported in 3 primary categories: skilled nursing facilities, other congregate settings, and community settings. Community settings is one of our county's 13 triggers, and we will discuss this in more detail in a moment. Of the 293 outbreaks, 163 or 56% are now closed or inactive, meaning that there have been no outbreaks in these settings in the past 14 days or longer. This leaves 130 or 44% of the 293 outbreaks that are active outbreaks. And of these, 26 or 30% are in the San Diego County's skilled nursing facilities, and there are 86 skilled nursing facilities in our county. In total, there have been 721 residents and 464 staff with the laboratory confirmed COVID-19, including 143 deaths. In the second category, 37 or 28% of the 130 active outbreaks are in non-skilled nursing facilities or other congregate settings. In this category, there have been 680 residents and 477 staff reported, which includes 91 deaths. And the third category is community settings. We have 67 or 52 of the 130 active outbreaks in this setting. Since March, the total community outbreaks have produced 1,152 laboratory-confirmed cases, including a total of 10 deaths. Now, next, I will review the 13 triggers for the County of San Diego. And as you can see on this slide, there are 3 triggers that are abnormal. However, 2 of them are heading in the right direction. So we have case rate, and it is abnormal when it is above 100 cases per 100,000 population. The second is community outbreaks, abnormal when there are 7 or more community outbreaks. And then the third is case investigations, and Supervisor Fletcher talked about that, and we are seeing that this number also is heading in the right direction. Now, for trigger number 1, which is related to case rate, this slide shows the metric, and it is one of 6 metrics that places any county in the state of California on the state's county monitoring list. And as you can see, currently the case rate is above 100 at 118.2. Since last week, the case rate continues to decrease and is moving in the right downward direction below 100. The results over the past 7 days are promising and is due to everyone doing their part to change this metric. So keep up the great work, San Diego. Trigger number 2 is related to community outbreaks. First, this slide shows all active and inactive community setting outbreaks since March 25th by month. And as you can clearly see here, most of the community setting outbreaks have been in the months of June and more significantly in July, 34 and 94 respectively. And these, if you can go back to the last slide, all of the outbreaks, the 159 outbreaks, represent 1,152 cases. So the next slide shows outbreaks since June 1st. And what we're trying to do here is show the various settings for the 34 outbreaks in June and the 94 outbreaks in July. And you can see that the primary settings included restaurants/bars at 48, another 8 in just restaurants alone, and then the second largest group is businesses at a total of 27 across the last 3 months, including just the first couple of days for August. And the next slide. So this slide shows the outbreak, community outbreak by date outbreak confirmed for the last 7 days. And this is, again, metric number 2 on our triggers. And for the past 7 days, we have had 39 outbreaks, with the largest number on July 30th. So if we go to the next slide. This is a breakout of the various sectors, or settings rather, for the 39 outbreaks over the past several months. Again, restaurants/bars, restaurants, and then businesses represent the largest, the 2 largest settings. In the very next slide, these are the 4 new outbreaks that were reported today. That is included in the 7 day, last 7 days actually, of community setting outbreaks. So 1 in each of these various settings: higher education, business, government, and a second in business. Next slide. So trigger number 11 is related to case investigations. This trigger is met if 70% or less of investigations are initiated within 24 hours of notification over the past 7-day period. Today's result is at 48% within the first 24 hours. This number has increased by 7% since yesterday and drastically since last week. In the past 3 days, the percentage has ranged from 61 to 81%. So we anticipate and expect that this number will return to a percentage that is above 70%, either by the end of the week or next week. We are adding new staff, and this is helping to improve this particular metric. With only 343 cases reported today, this should help to improve the backlog that is currently present because of the increased number of cases reported over the last 2 weeks. As a reminder, we would need to have 240 cases or less each day for 14 days to return to less than 100 cases per 100,000 population. In closing, getting through this pandemic requires that we all do our part. The majority of San Diegans are doing just that. Kudos go out to those businesses that have been responsive and innovative to implement the state's orders. And continuing these efforts will require that everyone adheres to the following: washing your hands and adhering to sanitation practices, staying 6 feet apart from each other while also wearing face coverings, avoiding crowds and not gathering, and staying home if you are sick. Now please welcome back to the podium Chairman Greg Cox. Thank you.
Okay, we'll go directly to the questions. First question.
Matt Hoffman from KPBS, please state your question.
Hi, I know that the governor today talked about Southern California doing well as a region as we progress through the pandemic, but in terms of getting off that state watch list, which carries those restrictions, you talked about the rate of cases per 100,000 residents, which is decreasing. From the modeling you guys are seeing or projecting, if this downward trend continues, when might we get off that state watch list and see some of these restrictions be lifted?
Okay, Dr. Wooten.
So this is a short answer, and thank you for the question. We would have to see for a period of 14 days less than 200 or 240 cases or less. And I have no way of predicting when those numbers will get to the point of less than 240 cases. We have had a couple of days over the past week where the total number of cases are in the 200s, so we want to see that continued downward projection. But again, that's the scenario that would need to be in place, but I can't predict when that would happen.
Gotcha. And I know we're still seeing outbreaks now weeks after restaurants and bars were ordered to close altogether or limit their operations. I mean, generally, why is that? I know it was kind of asked last week, but is the virus spreading outside, or are these outbreaks among employees or businesses just straight up flaunting the rules? So why are we seeing most of the outbreaks still coming from restaurants and bars?
Well, when people are attending or going to the restaurants and bars, they are sitting at tables, and they can have other individuals outside of their households. And when they're sitting at the tables, they are not wearing masks, and certainly you can't wear a facial covering if you're eating. So again, they have moved outdoors, which is guidance from the state. We know that evidence shows that indoor, because of ventilation, the risk of transmitting the virus is greater indoors. So we've been doing well for the past 10 to 14 days, but we have to continue in the trajectory that we are going. And so we have to continue to do what we are currently doing and even improve upon those efforts so that we can see these various metrics return to the normal targets that have been set. Thank you.
Thanks. And then just, sorry, one other one. NBC7 reporting that the first business owner in Ramona facing charges for violating the county public health order. Did you all from the health department side try to get voluntary compliance, and do you have any reaction to that charge coming from the DA's office?
For any of businesses that do not comply, the process is the same. We try to, we contact them and try to develop a relationship. And if they do not comply, then we do issue a cease and desist order. And if they do not comply with that, then we get law enforcement involved to issue the respective fines. Thank you.
Gotcha. Any reaction?
Okay, let's go to the next question.
Hunter Sowers from KUSI, please state your question.
Hi there. It's pretty similar, but I'm kind of a more direct side of it. We are seeing that for a bit there, the cases were going up, and now you've said today that we've made real progress. But I'm wondering, is there a way that the county can maybe not unroll back all of the restrictions, but at least start loosening some of them if we continue tracking in the right direction? I know some businesses have said moving outside, it's too hot right now. Is there a way we could see it adapt as this trend continues, as the county has said, in the right direction?
Okay, Dr. Wooten's going to respond.
Any guidance for change in the way businesses and sectors operate will have to come from the state. So, and if you watch the governor's briefings today and in previous days, that guidance is very clear. The guidance for any change or increasing the dimmer switch, if you will have to come from the governor's office. So it is not a decision that can be made at local jurisdictions by any local health department across the state of California.
And Dr. Wooten, I'm curious, as I'm looking at the graph, one of the graphs that we have, do you feel moving outdoors? I mean, we did see it slightly go up even a week, 2 weeks after. I know we're in our third week, but do you think that those restrictions placed on businesses are credited with why we're seeing maybe better trends this week specifically?
Absolutely, we do. And that was why the orders from the state were issued. There is evidence that shows, yes.
But still no way for the county to then say we can reward these businesses for doing so well by maybe easing some of the restrictions. That's not up to the county to decide?
That is not up to the county to decide. While there has been progress made, we still have a long ways to go. So again, any change in the orders will have to come from the governor's office. Thank you.
Okay, that completes our phone-in calls. We have one text message, and it regards some religious services in Cardiff, and Supervisor Fletcher will respond.
And this question is from Rachel Bianco from ABC 10 News. She asks, what progress has been made following up with the religious leader who held a huge rally in Cardiff last Sunday? Will he be cited in any way? There's talk of him holding another event in San Diego this month.
Yeah, the information we have in relation to that individual and that organization is they don't have any additional events planned in San Diego. If we come upon information that they do, then we can take the appropriate engagement with them to try and discourage, through whatever tools we have, that instance happening again. But right now, we don't see that that entity has any more events planned here in San Diego County. But we'll continue to monitor and look for any additional information. I also wanted to briefly just update on 2 testing sites. We now have 23 between the county and state testing sites in the county. One of them is moving. The location that has previously been at SDCCU Stadium will be moving to SDSU parking lot 17B. That'll be a drive-up testing, and that will be operating Monday through Saturday. And then we're adding a new testing site in Pacific Beach, mobile drive-up testing site at the Pacific Beach Taylor Library, and that will be operating on Tuesdays, and that will begin tomorrow. Thank you.
Well, that completes the calls for today or questions for today. Thank you for participating. Before we go, though, I wanted to take an opportunity to reemphasize something really, really important. Many of you have probably already received an invitation to take the 2020 census. We understand that during this pandemic, our lives have certainly been turned upside down, and maybe it's something like the census has kind of slipped away or gone to the back of your priority list. But it is critical to have a complete and accurate count of the number of people living in our region. Census data can help our region get funding for vital programs like healthcare, education, and transportation. If you haven't done it yet, please take the time to complete the questionnaire. It has never been easier to respond on your own. You can visit www.countme2020.org to learn more and certainly to take the census. We'll return here on Wednesday at 2:30 for an update, but tomorrow we will have a comprehensive update on the coronavirus at our Board of Supervisors meeting. The meeting starts at 9 a.m. For public health reasons, it will be a virtual meeting, but you can watch online at Facebook, Vimeo, YouTube, and Twitter. And if you'd like to participate, please visit the county's website at sandiegocounty.gov/telecomments. Please stay safe, and we'll see you on Wednesday at 2:30.